Hello and welcome to our panel. We're going to have a conversation today about the intersection between health and education during the pandemic, and especially during a looming legislative session that will focus in part on the budget, on the revenue, spending, and potential cuts that come with recessions like the one that we're in. I'll just briefly introduce everyone since you have a full bio in front of you. You can read up about us as we talk. Elena Marks is from the Episcopal Health Foundation. Stephanie Rubin is from Texans Care for Children. Pam Wells is from the Education Service Center number 4, Region 4. And Michelle Harper is at the Meadows Mental Health Policy Institute. And, as we explore this intersection of health and education, I'd like to, kind of start with a broad version of your goals as we go into a legislative session. And I'm talking more your goals before we get to the budget. As you walk into a budget, you start fighting over dollars and everything. And sometimes we lose sight, or legislators lose sight of what it is exactly that we're trying to do. So Elena, I want to start with you. You've done a lot of work on how COVID-19 and the pandemic have affected the number of insured people in Texas. There's a direct link here with education, and I think I'll toss the ball first to you.
Well, thanks. So as I look ahead to the session, I think about two opportunities that we are really following and trying to help promote. The first is what we've been talking about forever, and that is the high rate of uninsured people in Texas. We've had the highest rate as a percentage, and we've had the highest number for way too long in the entire country. And we have an opportunity to change that with Medicaid expansion. And my hope is that this cycle, including changes in the political situation, as well as negative changes to the state budget, may open an opportunity for Medicaid expansion, which could bring in another 1 million people into coverage. We'll have an opportunity for discussion this time when it hasn't in the last few sessions. The second thing that I'm really hoping to see more of in this session, and it began a little bit in the last session, is an appreciation by the legislature that health and healthcare are not the same thing, and that actually healthcare is just a means to an end. It's really important, but it is just one feature of what it takes to make a person, a family, a community healthy. And we use the tagline, health, not just healthcare, because there are so many other things that go into making communities healthy that have nothing to do with medical care. And what we've seen through both COVID and the conversations around racial justice and inequities have highlighted all of these non-healthcare factors that are really at the core of the inequities we see. And they translate over into the education setting just as well as they do in the health setting. So what I want to see is more people insured, and I think we have that opportunity with Medicaid expansion. And I want to see an increasing appreciation of an approach to holistic solutions to the problems that Texans face that are not siloed by the TEA budget or the HHSC budget or the DFPS budget.
Pam Wells, you're in a position to see, how these things play against each other and play in concert with each other. I'm going to come in kind of a side door here. There was a conversation started really by Governor Greg Abbott after the school shootings in Santa Fe, the church shooting in Sutherland Springs, bringing together people from a bunch of different kind of siloed areas of policymaking, including education, including mental health, including health. And I'm wondering if some of the partnerships that started there are useful now, and if those are being exploited. If you guys are calling the friends you made in that conversation.
So yes, unfortunately, the schools have had to deal with so much trauma, and the students have had to deal with so much trauma. And we knew when those things happened, when the tragedy occurred on May 18th, 2018, and then when we had things like Hurricane Harvey and all other kinds of things, we know that there are huge challenges that our schools face, both in terms of health and safety. And as Elena said, these are things that really are not just in a lane for education or a lane for health and human services. One of the things that we found out, though, is that those two groups didn't talk very much together. So although there were lots of initiatives related to education that HHSC had, and then there were some initiatives that the Texas Education Agency had, I think after those tragic events, there have been some opportunities for us to get together, to work more seamlessly together. I think there still are some areas where we could improve upon that. Currently, there really is no direct funding source for schools related to especially mental health. There really are not very many funding sources associated with what Elena calls health, just health in general. So I do think that there was some good work that was done in the last legislative session. I think there are some opportunities to go even further.
Michelle, Harper, that takes us to your area. Do you have some goals for this session and what you'd like to see the legislature pay attention to? We'll talk about exactly dollars in a minute, but what do you want them to do?
I mean, I know you said we're going to talk about dollars in a minute, but given where we're at and given the looming budget deficits, I mean, for us, maintaining the funds and the infrastructure that's been built around mental health statewide, whether it be in the pediatric setting, in the public health setting, in specialty care, in schools, there have been a number of avenues where we really have increased the infrastructure for mental health services statewide. And that's going to be one of our main goals, is trying to ensure that we don't go backwards, because we don't want to see that progress lost.
Do we have any precedent here? I mean, we talked about, the conversations that began, some would say that ended, depends on where you sit, with the shootings, and some recognition, at least from policymakers at the top, that these things are interconnected. And I'm wondering if any of that is coming to play yet in this, and whether you think it'll come to play as the legislature gets together.
I mean, we have seen a huge definite support for mental health services and the recognition of how important they are in all of the things you just mentioned, and in this pandemic. And I mean, we've looked at some statistics where you look at the increase in unemployment and what that means for suicides and overdosing. And so we've certainly been involved in conversations here in Texas, but also nationally, trying to make sure that folks understand the importance of things like telemedicine and telehealth, and trying to ensure that we're getting services. I mean, kids are going back to school now more anxious and having trouble, whether it's virtual or sitting in seats. And so what can we do to help support them? And so that's certainly, those have been some areas we've been focused on, and we've gotten support, and people seem to be interested in listening.
Stephanie, Rubin, you've been doing a lot of work with this interconnection and with, trying to bridge the silos. You've got really good policy here, really good policy here, really good policy here, kind of working independently of each other. What are your goals going into this legislative session, independent of the money, which we will get to?
Yeah, well, we can talk about the connections. And, I would say our goals are, I would list three of them. One is, first of all, a recognition by policymakers that the kids are not all right. And it's not just about what's happening at home. They're lacking, connections they're not going to the pediatrician, they're not getting vaccinated, they're not seeing their teachers who are supporters or counselors. They're, not having good peer interactions, all these things that they need, and that policy and systems are there to help if we have them funded and they're available. Many of these issues pre-existed COVID, right? Having the highest uninsured rate in the nation for kids pre-existed COVID, and it's gotten worse. In many ways, I want policymakers to understand that we've been at the bottom of the national list on a number of these items, and this now with COVID exacerbating what kids and families are going through, I would like to see the needs of kids and families much more of a high priority this session. And I agree with Michelle that we need to maintain investments in all these important programs, but I would suggest that kids and families have much higher needs than ever before. And I hope, and we're going to advocate for greater investment where it's needed. We can talk about where the money might come from, and I know other people are sort of, trying to kind of corral and protect funding, but kids and families are worse off than ever before. And then the last thing I would say is that we are trying to communicate really the importance of the early childhood years in terms of the payoff, the cost benefits in so many ways for, building healthy kids, getting them school ready, so many benefits over the long term that we hope, whether it's in the education field, the health field, or other, in terms of food insecurity, in terms of addressing trauma, that we really have to start as early as we can, helping moms and helping babies and helping young kids.
Mm-hmm. Pam, do legislators generally understand the schools as a delivery system for more than education? There's so many other things that go on here, from food to health, and on and on. And I'm curious what your experience has been with lawmakers and policymakers on that.
So I completely agree with you. When you're talking about schools, they truly have, from not only like cradle to career, but from sun up to sundown, they have responsibilities to help the students be more successful. And I think there's an increasing awareness of that. I'll give you an example. Everyone knows that really more than half of the children who were starting school virtually. And one of the things that's such a challenge that Stephanie mentioned is that we have many of the children, especially those who are early childhood and pre-K, who have not enrolled in school. And so these very children, and they are children from communities of poverty. We found that many of the communities where there are higher percentages of poverty, those families are disproportionately choosing not to have their children return to school because they know that in their own communities, the spread is so significant. And so we have some really significant challenges with the very students that need us the most. Stephanie mentioned food insecurity. That's a huge challenge when you have children not at school. They can't get those 3 meals a day that they have been being provided by the schools before. So I think there are so many examples where children are the inequities associated with life, associated with certainly with education, have been significantly exacerbated by the pandemic. And one of those that I'd like to talk about later when it's appropriate is this whole issue of connectivity, because I think that's a perfect example of something that crosses over education and health.
Elena, some of your studies have gone into this directly when you're talking about who's covered, who's not covered, the demographics of that. And I'm curious the extent to which that's been made worse by pandemic and recession, and which communities it's hitting in particular.
Well, we know who has been losing jobs during the recession, during the pandemic, actually. Actually, Texas did comparatively well during the recession compared to other states, but we have been seeing slippage across the country and in Texas in the number of people who are insured by employer-sponsored plans. That was the predominant way of people getting in coverage in this state, in this country. And our latest data shows that we're below 50% in Texas. And when your major source of insurance starts declining, then you really are in trouble because a lot of people are impacted by that. And the reason that we want everyone covered is not just because that gives them access to health care. That's really critically important. But once you are in some kind of a healthcare system, once you are covered by an insurance plan, somebody is taking an interest in your overall health. And that's a benefit that often doesn't get recognized when people are talking about the uninsured rate is so high. Oh, they can't go to the doctor. There's more that you get from being insured than just going to a doctor. And so that's part of the reason that we advocate so strongly for increased access to coverage, not just so you can go to the doctor, but because that brings you into a system that offers avenues to a whole lot of other services that are not just medical, because somebody's finally focused on you.
Mm-hmm, mm-hmm. Michelle, mental health is classically back burner when they talk about healthcare at the Texas legislature. It's, if they talk about something like telemedicine, they're talking about, well, we can see your leg from Midland, Texas, or we can see your leg in Midland, Texas, and less about counseling and the kinds of services that, honestly might be more needed now, with everybody disconnected and isolated than before. And I'm curious, when you're talking to legislators and to, everybody else, whether it's talking about funding or about programs, how's that going? And is it easier or harder to get some attention to those services in a time like this?
It's a great question. So far, people have been really open to the conversation and have really wanted to hear and listen to what we've had to say and how important, our physical health is being impacted, but with all of the things we were talking about, when you're fearful of, if you go to school, will you get sick? Or if your child's, does get sick, what's going to happen? Or if you've lost your job or you don't have food. There's so many things that impact our mental health. And I would say that a lot of folks are really understanding that right now when all of our communities are going through such a rough time. So we've been really pleased with with what the state has been doing to make sure that folks do get access to not only telemedicine and telehealth, but for mental health services, teleaudio. I know Pam mentioned broadband and what important that issue that is. In some of our rural communities, it's really hard to get access to telehealth. And so teleaudio has been a really important avenue. And so far there's been good support for that. And so anyway, I use that as an example to say people do seem to be recognizing how important folks' mental health is during these times.
Mm-hmm. Stephanie, give me an idea how important or how this education pipeline, the schools are as a delivery mechanism for all of these kinds of services. It's pretty easy to go back into the silo and say, let's take care of the schools, and then we'll take care of health, and then we'll take care of mental health. But you've done some work and some thinking about how these things are interconnected.
Yeah, and I would, just thinking back on last session when there was so much focus on House Bill 3 and school finance, and there was the School Finance Commission and an effort to focus on third grade reading. There was that conversation. That was a great conversation. And separately, there was a mental health conversation. Those two really did not generally meet. When we had a conversation about third grade reading, we had great new investment in full day pre-K, but there was not the kind of focus that was on the early childhood programs, maternal health, making sure that kids are starting off, healthy and have access to mental health supports and all kinds of things. So, the fact that some of these conversations happen in silos really is an issue. I personally would have really liked to see the kind of task force that happened after the school shootings that's around how do we align all the agency efforts to make sure kids and families are getting the supports they need across agencies. And, it would have been a really good opportunity to tackle that in the interim. No question, just like Pam says, kids, there are many schools that have on-campus mental health centers. There are some counselors. I think the education community would agree there's not enough behavioral health professionals on campus. And at the same time, there can be many more connections that happen between community health agencies with schools. And one thing we work on, in addition to trying to help schools support a child who has a diagnosed mental health need, is just having a positive school climate, where kids feel supported when they get there. If there's any kind of behavioral issues, there's questions about what might be underlaying those issues. May not be a bad behavior or mental health need, but just maybe something going on at home, family stress. Many of these are community challenges, and I would say we need some more education of legislators about the fact that family stress really can impact kids and really can impact their ability to do well in school. So of course, hunger, of course, not going to the pediatrician, not getting asthma medication, having, oral health problems, absolutely that's going to affect a kid's learning. But what's happening in their home, serious family stress, lack of jobs, losing apartments, worry about a family member who's sick with COVID or something else like that, that is going to make it very difficult for that child to learn. So we do have to tackle it in a comprehensive way.
Okay, I promised we'd talk about the budget. So let's talk about the budget a little bit. The legislature's coming in this time. Glenn Hager, the controller, has already said that they're going to be several $billion short in the current budget, something that I imagine that they will tackle, as they usually do, pretty early in the session with some supplemental appropriations. It looks like if they wanted to, they already have enough money to take care of the situation in the current budget, which runs through the end of August. You could go to the rainy day fund, you could do a number of things. But immediately after they fix that, they're going to have a 2-year budget to write, which is really where a lot of the meat of this session is going to be, and a lot of the anxiety about this session already exists. And I kind of want to let's go in the gloom and doom door first. What's your worst fear about this? What's your worst expectation about what the legislature is going to have to cut, what they typically cut? Let's go backwards this time. Stephanie, you want to take the first swing at that?
Well, of course, we always hear that education and healthcare have to be pitted against one another because they're the biggest, parts of the pie in the budget. And I think it's more important than ever that in a unified way, we have to argue that that's sort of a false frame altogether, that we shouldn't pit them against each other. Just like we're saying, kids aren't going to do well in school without good health for their health care and services for their parents. And so we need to move away from that frame and really talk about how do we make sure kids and families get the services they need, even if they're enhanced, because there are revenue options. So that's the other thing that's really important to convey is, yes, we are in some dire economic circumstances, but there are revenue options. There's the rainy day fund. Hopefully we'll get more stimulus funding. There's other healthcare at the federal level. There's other revenue discussions that are happening. And I think it's really important to talk about what kids and families need, not how we tighten our belts.
Yeah. Michelle, you want to swing?
So, I know I mentioned it earlier, but for us, it's going to be really important, like I mentioned, to maintain the gains that we've had these last 3 sessions. This last session was really exciting because there was more an emphasis on schools, and there was more discussion about how do we fund schools to create supportive environments for youth. We had the $100 million in SB 11 that could be used for hardening, but also for mental health supports. There's HB 19 that provided a staff position to the ESCs to help create supports for schools. So there have been a number of different instances. Then there's the Children's Mental Health Consortium that got funds to help support pediatricians as well as schools and workforce development and such. And so I use those as examples. I again would just say that one of our big focuses is going to be on trying to maintain things like that.
Mm-hmm. Mm-hmm. Elena, you've talked a little bit about healthcare and about insurance. How's that figure in the budget conversation? And what are you afraid they might do, and what are you going to do about it?
Well, so I want to make 2 comments about this. If we can look at the Medicaid expansion opportunity based on data and not ideology, the case for expansion is extremely compelling. There have been studies done over the past 8 years at various points in time that show that there is an economic benefit to the state budget, to the budgets of local governments, and to the budgets of local economies because of a Medicaid expansion. It's a 9-to-1 match from the feds, and there are ways to pay for the state's 10% match that actually are extremely affordable and that are more than paid for by the multiplier effect of the investment. We're talking about billions of dollars a year that the state has been leaving on the table, I would say largely based on ideological constraints. We don't have time for that this time around. We can't afford to let ideology get in the way of real needs, especially if it can improve the economy and improve the state's budget. Secondly, the state has to get its head around the value of investing in prevention. And that means investing earlier and earlier in a child's life, I would say in a pregnant woman's life, I would say in the life of a woman who may or may not want to get pregnant, and to recognize the value of investing in prevention that doesn't necessarily pay off next week or next year or next month, but is well documented to pay off over the life cycle of a child or a family if we can invest in it. And in a really tight budget, one of the opportunities that the state has is to invest in that kind of upstream work through creative financing mechanisms like a pay-for-success strategy. Several sessions ago, the state approved state agencies to invest in outcomes-based contracting. And what that means is that investors pay on the front end for various kinds of interventions that if they work out, and only if they work out, the state then repays on the back end. So the state doesn't have to take the risk of paying for something where they can't see what the outcome is and they can't get their hands around it and they don't want to take the risk. And we are doing things right now with state general revenue dollars that could be part of a pay-for-success program, either to try new things or to scale existing programs in a way that spurs early intervention and investment upstream with the financial risk attaching to investors and not the state. And it's hard work, but it can be done, and other states are doing this.
Mm-hmm. Okay. Pam, I know you can't advocate from your seat, but I know that you go before the legislature a lot to talk about, the situation in schools. And I'm curious, generally, and we'll get a little more specific, but generally I'm curious what areas you see where the public schools might need to devote some resources that maybe they weren't thinking about a minute ago. I mean, you've already mentioned one in connectivity and in getting broadband internet to people in poorer neighborhoods and urban settings and to unserved areas in rural settings. Can you go through some of that when the legislature comes to you and says, okay, so what do we need?
So connectivity clearly is an issue. We have more than half of the students in the state who are learning virtually. I'm so pleased that the governor and the leadership came up with a matching program that actually the commissioner in July asked Region 4 to help manage for the state. It was a bulk order purchase of both e-learning devices and also hotspots. And the whole goal of that was, of course, virtual learning, but the added benefit was that families could utilize those hotspots and that technology to be able to do telemedicine, to be able to find jobs, to be able to get information about health that often is only provided in a web kind of focus. So clearly connectivity, I think, is a huge equity issue that crosses all of our areas. I will tell you that the greatest concern that the school district superintendents have right now as it relates to funding actually starts with a challenge that they have just to help educate children. There are too many children who have not enrolled either in face-to-face or in virtual learning. It ranges anywhere in the Houston area from maybe around 4.5% up to 10% of the children who have not yet enrolled. And even those who have enrolled, many of them are not attending as well. And so we have a huge issue with students losing instruction. But that also translates to a monumental problem for funding because school districts are funded based on ADA. And so as the enrollments go down, the school districts are looking at potentially huge cuts. Now, they have been given an 18-week hold harmless, but right. After that, if we're still in the same circumstances we're in right now, the school districts are looking at potentially bigger cuts than occurred in 2011. And we all know what happened after that in terms of student performance. In addition, one other thing that really a lot of people don't realize is it's a wonderful thing that the federal government gave waivers and the state gave waivers for children to be able to access food through the child nutrition program. But what has happened is families are choosing now not to apply for free and reduced lunch. That is going to hugely impact our school districts as it relates to comp ed funding. So it's like a triple whammy. It's lower enrollment, lower participation, and also the huge challenges associated with many, many fewer children being identified as free and reduced lunch, which dramatically impacts their funding. So funding is a huge challenge for our schools coming up into this session.
Yeah, Stephanie, how does that ripple through? If the kids aren't in school and they're not getting all of these other things that the schools provide, whether it's breakfast or healthcare or something like that, this is bigger than, I mean, education is huge, but this is bigger than just a cohort not getting educated.
Well, I don't know if we know where the kids are. Are they at home and they're being watched by a parent? Are they at home being watched by the 10-year-old brother? Are they in a child care center that's really underfunded right now and could use some more support in order to provide high quality, preschool for that child until they get to school? Are they under the care of someone who's neglecting, or abusing them? I think, we haven't done that kind of analysis yet, and we need to. I also worry a little bit about just thinking about, you mentioned current year budget. We already had the state propose cuts to women's health, to outreach and enrollment programs in the healthcare space, to early childhood intervention. I mean, these were all short-sighted cuts. Some of them still remain under consideration. So if that is what we're thinking we may face during the session, that's bad news. I agree with Elena that we need to be thinking about strategic investments that will have some short-term payoffs for kids and families now, but they will also have long-term ones as well. And I just want to stress that the way we're communicating with our partners is, of course, we all have programs that we want to fight for. We are given grant funding or other funding to sort of protect certain buckets. But the truth is, if education is fully funded, but our health and human services programs are not, we're not going to get the educational outcomes we hope for. So we have to think about them holistically. And it's a challenge in the way the budget committees are set up, the policy committees are set up. There's 7 state agencies that oversee funding for kids and families. It requires much more alignment than we've seen so far. But there's time. And the last thing I would say is that for all these issues that my colleagues have highlighted, there are policy solutions, well-vetted, researched ones that have either are being piloted here or happening at a smaller scale, or we know from other states, whether they're Florida, Georgia, some of our similar kinds of states, we've seen them work. Medicaid expansion is a perfect example of that, where Missouri and Oklahoma and Nebraska just passed it. And so I really hope that legislators are very open-minded about the solutions that will produce the best results for Texas kids and families.
Yeah. Michelle, some of those separations between this policy area and that policy area also exist outside of government. And I'm curious if people like the 4 of you are talking or planning to talk, or, I mean, when you go to the legislature, is there something of a united front? Or if I'm a legislator, am I sitting listening to each of what's the old parable about the 7 blind people describing an elephant? Can you guys get together on what the elephant looks like?
Well, we're kind of a unique organization. I know my partners here on the phone know this. We're not an advocacy organization, but we do look for opportunities to make a difference. And we certainly are always, wanting to put forward really good ideas when it comes to best practices around mental health and the delivery of services. And schools are a huge partner in that. And Stephanie mentioned earlier about how important it is to have not only just interventions, but but a real positive school culture that is supportive of youth and helping ensure that they get access to services they need. We do look for opportunities to partner. And so I've gotten to partner with Pam and her team on looking at a framework for mental health supports. What does that look like? She serves 1.2 million children. And so how could they provide really great trainings and be strategic about that and other supports. With Stephanie, we're super excited to get to work with her and be invited to a coalition she's leading on school readiness. And so we are always looking for ways to partner, even though we're not an advocacy organization.
Are there some things that, if I was sitting in the audience here, that outside voices would help? To some extent, you guys are familiar to the legislature, and lawmakers, to some extent know what you're going to say, and to some extent react to experts better than they do to the public, and to some extent react to the public better than they do to experts. And I'm curious if you were talking to people who aren't normally engaged or aren't always engaged on every subject in the legislature, what might be some of the helpful things here that they could do? Anybody can grab that.
I'll grab that.
Okay.
I hope I heard you right, Ross. You're asking what other people, not those of us who are sitting here, can do.
No, I'm like, talk to the audience. I mean, what could they do?
Yeah. So figure out the issues that you care about, figure out the groups that are good at advocating for them, and figure out what you can do alongside them. A lot of the groups put together coalitions of grassroots people on the ground. They bring them up on buses for lobby days. They have write-in campaigns, but there are lots of opportunities around for people who want to engage on any of these ideas. And most of the groups I know have a strategic focus on getting community organizations to join forces with them to talk about whatever the issue is. So there's a lot of opportunity. And I think you're absolutely right that we show up with all this data because that's what we do.
Right.
But the people who have real life stories are very compelling advocates, and often more compelling advocates than we are, because they relate just as a person with a story.
Okay.
The other thing I would add to that, Ross, is that I think it's important for philanthropy to communicate that whatever investments they're making in their local communities, and I'm sure many are doing more than ever, they're never going to make up enough. They're never going to be enough to cover all uninsured kids, all uninsured parents. That policy and system change is the only way to make sure that kids and families across the state have better access to the supports and services they need. And I think absolutely we need more community voices to talk about what kind of policies would help them, and that voice has to be at the table. But even just a phone call or a text from philanthropists to their legislator saying, this is a really important program, I hope you take a look at it. Just like you all did with education, you really elevated the importance of adequately funding education and making positive changes in the education policy sphere. And I think in order to maximize that work and investment, that working on the health side is really important at this time.
Okay. We just have a couple of minutes left. I want to give each of you a chance to say some version of, it's the end of the session and you've gotten a result that you want. It's not a perfect world. We all know that. It's a reasonable world. What do things look like if this session turns out the way you hope it turns out? Pam, you want to shoot at that first?
I guess so. I was actually going to quickly tell a story, and I think it may answer your question. Sure. I think if, at the end of this session, I think if the legislators understand the stories about real children and real people and real families, and I even think this is something that the audience can help with as well. Yesterday, when I was talking with Ross, I told him that I ended up crying yesterday, because I have a 3-year-old grandson, and obviously he's lucky because he has a family that has done everything they possibly can to help him. He's 3.5 years old. He has missed out on almost an entire year of early childhood and connections with children. Because of a family circumstance, he can't be around other kids right now. And so I was talking to him about something, and he looked at me and he said, Graham, he calls me Graham. He said, Graham, because of the sickness, I can't be with my friends at school. He said, when the sickness is over, I'm going to get to go to school and I'm going to get to learn. And he said, and I'm going to get to eat lunch with my friend. He started naming everything that he's ever done when he was in his preschool. But it was because of the sickness, I can't do this. And as I said, he's lucky. There are lots of children that because of the sickness, they are in a situation, as Stephanie mentioned, where they don't have the opportunities that my grandson has, and even he is suffering. So I hope if at the end of this session that we've thought about those individual children, those individual people.
Great. Michelle, what does the end of a pretty good session look like to you?
For me, we'd still be gaining and getting children access to services. I mean, prior to the work that's been done these last 3 sessions, children were waiting 8 to 10 years to get services, which meant their needs became more intensive. They had a hard time learning in school. And if I had my pie in the sky dream, not only that, but through collaborations with everybody who's listening to us today, their parents would get access to services today too, because what we hear from schools so often is that they've done all these amazing creative ways to get students care. Well, and these days they're even doing telemedicine, but then their families don't have access to services, and their families are being, especially for younger children, who are so important to keeping them healthy and well. So that would be my ideal.
Okay, Elena?
Medicaid expansion would be my ideal. It opens the door to so many more opportunities for so many more families.
Okay. Stephanie, I'll give you the close.
So ditto to everything, but I would also say, just like last session, when legislators on a bipartisan basis were very proud of their work on school finance and very proud of the work on mental health, my hope is that at the end of this session on a bipartisan basis, they're very happy about working together to expand access to healthcare, take care of kids, take care of families, and that they realize whatever they've done this session is one step of many they're going to need to take in order to improve the health and well-being of Texans.
Okay, great. Wherever you are, I hope you'll clap your hands, if you're alone or with your friends or whatever, for Elena Marks from the Episcopal Health Foundation, Stephanie Rubin from Texans Care for Children, Pam Wells from the state's Education Service Center, Region 4, and Michelle Harper from the Meadows Mental Health Policy Institute. Thanks.